Okay, so thank you, Nuri, for having me today. I'm very glad to share with you our experience regarding the 3D and placenta models for training in vascular and endovascular neurosurgery. My name is Simone Peschillo. I come from Rome, from Italy, and I would like today to share our experience on how we try to train not only residents but also young specialists in open vascular and endovascular neurosurgery. First of all, the challenge of neurovascular training is increasingly complex, because especially for open neurosurgeons, they have to deal with complex neurovascular pathologies, because nowadays probably 80% of the cases can be done by endovascular. So traditional surgery reduced, and there is a predominance of endovascular treatments. They have a limited case availability and longer learning curve compared to endovascular neurosurgery. So that's why there is a need for simulation and alternative models to acquire the skills. Let's take an overview about the challenge of endovascular training. We have to train residents to navigate complex anatomy with tortuous or narrow cerebral vessels, patient-specific anatomic variation that require precise catheter and guide wire manipulation. They have to deal also with procedural risk management, with simulation of aneurysm, rupture or vessel perforation, thrombosis or embolization scenarios, and vessel spasm management. And also they have to learn what kind of device is the best device for the treatment, and they have to have familiarity for the new devices that are on the market. So training with many microcatheters, stents, flow diverters, intrasaccular devices, and aspiration catheter. And they should practice deployment techniques and troubleshooting. They have also deal with intraprocedural decision making, with rapid response to complications, and hemodynamic monitoring and adjustments. What are the benefits of simulation training? Risk-free training. Trainees can practice and refine skills without any risk of harm to patients. They could have a repetitive practice. They can enhance proficiency, and they can be exposed to rare cases and rare scenarios. And they could also have a specific patient training using, for example, existing exam where we can recreate 3D printing of their aneurysm, for example. And they also can have a standardized education with simulators and other devices that we can provide. So, of course, cadavers are the gold standard, but they are limited and they are very expensive, and it's not so easy to recreate the real scenario. Other models, like animal models, are useful, but there is some issue regarding ethical and biological limits. 3D printed models could be useful. VR simulation are repeatable, and we can create specific scenarios. But also we have a human placenta. Human placenta is a very interesting model, because it can provide a realistic vasculature for the vessels, and we can also recreate a perfusion of placenta, simulation where we can simulate the real life bleeding. is a valuable tool for microsurgical and endovascular training, and the last but not least is free. So we have created two main training programs. In my university we have started this Translational Research Center for Endovascular Neurosurgery, where we can not only develop but also test new devices that are now on the market, but also help industry with the R&D departments to create better devices. And we have just launched the European Neurovascular and Endovascular Training Center, but at the end of this presentation I would like to talk about more on that. So let's take a step back, and I would like to show you the human placenta. Human placenta is, the name placenta comes from the Latin, and actually the name is, the meaning is, the shape is like a pizza. So we have different dimension shapes, but the main characteristics is still the same, just to provide the vessels and to replicate the brain vasculature. So we have standardized this, the use of this placenta. We use the umbilical veins and the arterial veins just to wash the placenta, and this is the placenta ready to be used not only for open vascular training but also for endovascular. And let's take a look. The vessels are very close to the dimensions and the length of the brain vessels. And we started actually 8 years ago using this model. We were the first center in Europe using this model for the endovascular training. And we use it not only for open vascular but also for endovascular and in the angio suite. I would like to show you how it appears during an injection. So it seems like the MCA and the ACA here. But the most valuable tool is that we can use everything, carotid stents, intracranial stents, we can perform thrombectomy, we can perform embolization of the aneurysm. We can do everything. But I think that the most valuable characteristic is that we can also provide a rupture. So we can see the intraoperative rupture. And it's very close to the real scenario where we can see the extravasation of the contrast medium. And in 2018, we started also using the OCT. Most of you are very familiar with OCT because OCT is a device that is commonly using in cardiac procedures. And now, a couple of weeks ago, was published this paper on JNIS regarding the use of the OCT in neurointervention. OCT it's like a probe, it's a catheter that can be used to study inside and in vivo the stent in the cardiac circulation. But in 2018 we started use it in neurovascular procedures, and we use it in placenta models, and we have seen which are the difference between no stent, with Atlas stent, and with flow diverter stent. So that was at the time very interesting, because this is an ex vivo model, but we have clearly the clear result of the stent apposition or flow diverter apposition. 2 years ago, we also started using the perfused placenta. Here is an example. We use this POP model where you can connect the vessels of placenta and have the same perfusion of any other organ that you can use. And you can be trained to deploy a clip in a perfused placenta using microscope, or even more here, vessel dissection. This is me, and I would like here to show you how, yes, is the rupture of the perfused placenta. And this is the setup of the boot camp that we organize every year, where we use this perfused placenta, and we welcome young physicians to be trained using this method. But also we have endovascular flow model, and I would like to show you this brand new flow model for aneurysm. So here there is a flow model. Can you see the silicon? No, because this is completely transparent silicon, and here if we inject the contrast medium, we can see the aneurysm. We can navigate with microwire, microcatheter. We can deploy the device, and we can see clearly the characteristic of the device with a mesh stent, or if we are using aspiration catheter, we can see the characteristics of the catheter or endosaccular device. And here is the comparison between the flow model with contrast medium or without. And also we have developed another flow model, the MMA flow model, because nowadays in endovascular neurosurgery, MMA embolization is a hot topic. And this is what we have done, is a completely transparent model where you can inject and you can have the same real feeling that you can have in the angio suite. And you can use every kind of anatomy that you want. You can create it whatever you want. And last year we used this model in the ENS MMA embolization course, and this is how it appears. So it's when you inject the contrast medium is completely you can see the vessels, and otherwise it's completely radiotransparent. And here you can see that you can use coils to do embolization of the MMA, or you can use onyx or squid. And look here, it's very, very realistic, because you can inject and even you have reflux. So in conclusion, we have nowadays a lot of tools that can allow us and allow the trainees to have a safe training environment. We can faster the learning curve, improve confidence and technical ability, and we can standardize the practice with reproducible and measurable training scenarios. And we can offer also a realistic experience from anatomical models to biological and flow simulation. And we can also test the new device, and we can offer a safe platform to try for trial and to refine new technology. And I would like to finish my presentation with this couple of slides to introduce you what we are doing in Europe, just to offer different kind of training scenario This is the European Neurovascular and Endovascular Training Center. We are planned to organize every month in Rome, in my university, 4 kind of training courses: open vascular, endovascular, hybrid, and live surgery. Every month we have scheduled a session. We have a limited spot. Just offer to anyone who wants to be trained and to have the state-of-the-art laboratory and endovascular environment to be trained. In May, in 7-8 May, in Rome, we have the 2nd edition of the MMA Chronic Subdural Hematoma hands-on course. And in October, we will have the SNAC, the Surgical Neurovascular Angiography Anatomy course. This is a special create for young physicians that want to be more, want to learn more about the neurovascular anatomy, neurovascular angiography. Even if you are, and even if you want to be an open vascular neurosurgeon, you must know the angiography anatomy. And if you want to do endovascular procedures, you must know the microsurgical anatomy. This could help you in your clinical practice. And last but not least, the major program. This is the ENS, European Vascular and Endovascular Neurosurgery Master Program. This will be the 5th edition. The application we will open in June, and the course will start from November to the October of the next year. And the idea is to offer 14 European centers where people can be trained in open vascular procedures, in endovascular procedures, and in hybrid procedures. We have 14 centers across Europe, also in Sofia with Dr. Aliowski. So we are very happy to have you on board, Nuri. And the main idea is to train these people to spend at least 800 hours in the angio suite or in OR to do procedures, and at the end of the year, the fellows will receive a diploma from my university that can be used across Europe. So I would like to thank you, all of you, and I'm happy to answer to any question. Thank you.
Sorry, you're working at University Hospital, am I right, in Rome? Congratulations, fantastic work. I didn't know anything about placenta use. Great. Do you train your residents in neurosurgery on day-to-day basis with the placenta? So do you have these trainings ready for your residents every day, or only during organization of these courses?
Thank you for your question. Every day is quite hard because the time is not so much. So our schedule is to have at least 1 session per month. And that's why we started offer this session also not only for our residents, but to open to everyone who wants to apply and to visit us.
I have some residents in mind, so.
Yes, please. The training center is open not only to neurosurgeons, but to neurologists, to neuroradiologists. For example, if a neuroradiologist wants to try to do micro dissection, he or she is very welcome. I think that could be improve their clinical practice and also their dexterity.
So you do not have any legal issues regarding using placenta?
Everything is legal.
Yeah, okay. Everything's legal and everything. I
Yeah, absolutely.
You know, but
I
did
don't.
you have to overcome some maybe to invent some regulations and in order to start to use placenta progressively?
Yes, of course, we had to apply to the ethic committee exactly, but if you're using under this special aim and scope, there is no problem. Normally, I don't spend my night goes in the stolen placenta in the hospitals. Thank you so much.